Okay, that's the message for doctors then, is to start to learn how to integrate these things into our practice.
As a person who has symptoms, palpitations, chest pain, breathing problems, something I don't know, that idea of minute to minute getting alerts, getting warnings in the middle of the night can be quite scary.
That I think has changed medicine and will change medicine in the future over the past couple of years has been glucose monitoring via the skin, so transcutaneous glucose monitoring. They're not quite wearables, they're little patches with a tiny needle in that measure people's glucose from minute to minute.
Can I give you a stat?
Yeah, go.
There is more atrial fibrillation in India than there is in Europe and America put together, right? Because the health systems are still growing and maturing. Whereas in the UK and the US, we've got much more advanced screening systems for people as they get older.
Yeah.
So wearables could possibly be a tool that doctors and companies can use to identify. This time we're doing things differently. We've listened to your feedback and we've decided to build in a bit more debate and discussion and controversy around some of the topics we bring to you. So a lot of the things we've talked about, such as hypertension, diabetes management, it's all well established and there's been a lot of information out there. However, a lot of the questions that come from patients and people in clinic are in the gray zones.
Yep.
So where the evidence is unsure, where the evidence is still growing. And those are the questions that I think people really want to know the answer to. So we've structured a series of debates here where we're going to talk about some of these hot topics and hopefully present both sides of the argument and then have a discussion.
Let's see how it goes.
Yeah.
All right.
So we'll start off with the first hypothesis, which is wearables can improve health outcomes in people with heart disease. So Joshi, do you want to give us the argument for this?
Yeah, I mean, I think wearables, fascinating area of health, primarily because it's not been driven by physicians, right? So the reason why there is debate, the reason why there is a question as to whether these things work or not is because tech companies, inventors, entrepreneurs, for the most part, have been at the forefront of developing the technologies, and then they've been able to apply them directly to the consumer, directly to you, our audience, rather than having to come and be prescribed by someone like me. So that's why there's debate, because firstly, you'll notice debate in medicine, whenever the doctor doesn't have control, there's always an argument to be had about whether it's safe or whether it's relevant. And that'll be a theme, I think, over the coming debates. Why do I like wearables? Well, the first is I think that it highlights immediately to the person their health, right? So if you've gone and taken up a wearable, let's say an Apple Watch or a Fitbit, we'll come on to a couple of other types of wearable in a couple of minutes. You've made a decision to put your health within your information sphere. You've made a decision to measure your health. It means you're focusing on your own well-being. And I love that. I love people taking control of their own healthcare. There are some really important measurements that wearables can make. So your Apple Watch or Fitbit can monitor your sleep. And we know that good, healthy sleep leads to good cardiovascular outcomes. It can monitor heart rate variation and heart rate variability, which we know are linked to health. There are more and increasingly advanced technologies that can measure minute-to-minute blood pressure on a wearable, which is incredible because there's no debate that having high blood pressure leads to heart disease. You don't have to go through some sort of proof of concept, high blood pressure, heart disease or stroke. And if you can measure that on a day-to-day basis and monitor it well, then you've got a really good insight into your own health. I would take the concept of wearable, if I may, a little bit further than just the watches.
Go for it.
One of the things that I think has changed medicine and will change medicine in the future over the past couple of years has been glucose monitoring via the skin, so transcutaneous glucose monitoring. They're not quite wearables, they're little patches with a tiny needle in that measure people's glucose from minute to minute. And as those technologies become adapted for other biomarkers of illness that are also modifiable, I can see that becoming an incredible interface for minute-to-minute monitoring of your health, which allows a more accurate, probably, a definitely more balanced and nuanced approach to healthcare prevention. So I love it. And then there are, of course, the kind of life-saving things that some wearable technologies can do, identifying cardiac arrests, probably a bit late, but identifying other abnormal heart rhythms through heart rhythm monitors or reductions in oxygen saturation and other illnesses, I think, really valuable. And I think the challenge to doctors, and the reason why we might find some debate against them, is that worry about safety, which is legitimate, worry about what we do with this data, which is legitimate. I'm sure you'll come on to these things. I think many of those things stem from a doctor's perceived lack of control over the information flow, which we hate as physicians, but it empowers people, patients and people who aren't patients, to control their healthcare with data. And so I'm a big fan of these things going forward.
Great. So that's the pro argument. If I can take the other side and think about it from a patient's point of view, the words you said of minute by minute. And as a person who has symptoms, palpitations, chest pain, breathing problems, something I don't know, that idea of minute to minute getting alerts, getting warnings in the middle of the night can be quite scary. So all that data being accumulated we as doctors need to understand what to do with it, because otherwise patients are left with the burden of all this information, having all these alerts, having all these notifications. And we know that in patients with atrial fibrillation who go and buy this watch in the shop, they then end up coming into A&E very anxious, very concerned. What is this heart problem? And us as doctors will say, well, I don't know. I don't know what your tracing actually shows me. I don't know what I'm meant to do when I see this. So I agree that there's a lot of potential here, but the state of the play today is that the data that patients are collecting is vast, and we don't know what to do with it. They don't necessarily know what to do with it. The big tech companies have made their subscription sales, and the users are buying it, paying money to be shown all these fancy graphs and data which look nice, but potentially lead to a lot of anxiety. The second argument is a lot of the data that says these things work or that these things can be helpful come from Caucasian populations that they're tested in groups of people in the USA, which are mainly white. We know that when you've got something on your wrist that's shining light through the skin to get the data, we know that on brown skin or black skin, it does not perform as well.
Right.
So we are looking at information that is being trained or derived from white people and expecting me or you or any of our Asian listeners to go to the shops and have the same results. There's a risk of missing things. There's a risk of inaccurate diagnoses and not seeing things properly there. I think so that brings in the sort of risks from different skin colors, but also more broadly than that, we're risking siloing and making a two-tier health system where a person with money and a person who's driven to look after themselves will have a glucose monitor on their arm, will have a blood pressure monitor on their arm, will have an Apple Watch on their arm, will have a wearable t-shirt that's measuring additional things. And, is that person really giving themselves better healthcare? I don't know. But if we build a health model where we are working on improving the health of a system where a person has all this data, we are ignoring a huge number of the population who cannot afford access to other types of healthcare. And then, we're building all this data based on wearables, which a lot of people don't have access to. So we've got to think about how any wearable devices can be accessible, and the data we're learning is representative of people as a whole.
That's a great point. So quite a lot of the objection that I heard from you, and I think is reasonable, is about either the exclusivity of these data platforms, where if you're wearing the thing, you can afford to wear it clearly, or in some cases, just the kind of ethnic applicability. And that second one is surely soluble, right? Like there are 1 billion people in India. You only need a few thousand smartwatches to just calibrate it properly. Has that happened yet?
I mean, so going back to your first sentence, which is this is not a doctor-led discovery or technology. So these tools are being built by consumer-facing behemoths, tech giants, and a lot of the money that these companies earn is coming from the Western world, which is a predominantly Caucasian society. Sure. And so the incentive is a financial one for a lot of these companies. Of course, there are also a lot of good motives, but that motive needs to be built out. And of course, this is an important conversation that is being had. I don't want to say that it's not being had in technology companies, but I agree with you that a doctor's role here is to ask these questions and say, okay, we are going to think about how we can use these devices for health in general. And so that's the sort of groups we need to be doing our trials on: men, women, people from diverse backgrounds. And when you give the tool to a person, you can then bypass a lot of those biases that when people have to go and pay for it in the shop. So I agree with you, like in an integrated system, these devices can be incredibly powerful, but we have to build those systems so that patients don't have the whole responsibility of managing that data.
Right. And I suppose that firstly, there's a gap in the market then for a kind of Indian-built a monitoring device that's attuned to the Indian physiology and skin tone in Indian populations. Yeah. If you think that the bigger tech companies aren't interested in that market at the moment.
Can I give you a stat?
Yeah, go.
So there is more atrial fibrillation in India than there is in Europe and America put together. Right. And of course, we don't know about it, and the numbers are not seen in a country like India because the health systems are still growing and maturing. Whereas in the UK and the US, we've got much more advanced screening systems for people as they get older.
Yeah.
So wearables could possibly be a tool that doctors and companies can use to identify all sorts of heart problems that we just don't know about. We spoke about in our hypertension episode, something like 10% of people in India may have hypertension and not know about it.
Yeah. Okay, so let's talk about specifically atrial fibrillation then, which is an irregular rhythm of the heart. The reason it matters, apart from it being uncomfortable, is that it can increase your chance of having a stroke. Yes? Right. But if I remember when I was learning about it, quite a lot of atrial fibrillation, people don't notice. They don't feel it in their chest or like palpitations. So is that what you were saying when people get anxious alerts from their Apple Watch or something to say you've got this abnormal heart rhythm and they didn't even know they had a problem? Is that happening?
So that is what's been published, and that is the concern that doctors often say of, oh, if a person goes and buys a smartwatch themselves, they get really anxious. And that has been reported. Now, we at Barts have just released a study where we didn't do that. We took patients who had diagnosis of atrial fibrillation and gave them a watch and didn't say, go home and do what you want with it. We said, this is the system. This is how we want you to record it. If you find an abnormality, bring it in with us. And we saw the opposite. We saw that quality of life stayed the same and patients actually stayed out of hospital and reduced the amount of time they came into hospital.
Wow, amazing. So because you had the monitor and you were linked into an established healthcare service, right? And you knew you had backup if you needed it, people tended to be more relaxed about these abnormalities if they saw them on their heart rhythm monitors. Whereas if they were just out there in the wild, they bought them for themselves and the only thing they could rely on was Googling it, they were less reassured.
I think so. I mean, we didn't test against the people who bought it themselves.
Okay.
But that's what we saw in a different study. And so I think that is the hypothesis, at least, that if a wearable is being used as part of a healthcare treatment by a doctor with supervision, you can have benefits in health quality and health outcomes. Whereas if someone just goes out and buys it themselves to look after their health themselves, most of the time they get a lot of information, it's overwhelming and can lead to some anxiety.
Okay, that's the message for doctors then, is to start to learn how to integrate these things into our practice rather than for our audience to kind of stop using them, right? Like we think there's probably health benefit in there, but we need to work out how to extract it as a system.
I agree. And I think if tech companies alone are doing this, you won't get the best outcome. If doctors alone are doing this, you won't get the best outcome. Working together and integrating it all is the best way that we can build things properly.
I hope so, although it's increasingly difficult to tell the difference between a tech company and a healthcare company this month. We'll come on to that maybe in another debate. Okay, what do we think? So I came out all guns blazing in support of these things. I probably nuanced my ideas given the increase in anxiety people can have if they don't have them in a kind of framework that gives them an expected outcome so that we understand what it means to get an alert or an alarm for one of your healthcare devices or your wearables. What do you think about wearable glucose monitors and other biomarker monitors then? Let's say I said to you that we should wear one and we should measure about 10 different biomarkers and we're not really sure what we're going to do with it, but maybe it'll give you some insight into your health. Good idea or?
So I'm a tech optimist and I like experimenting with these things. They're available over the counter and I'm aware that I'm spending money on something which doesn't have an evidence base. And I think if you go into it like that to test it out and try it out for you, then you have to go in acknowledging there may be some anxiety. You need to be able to handle that data and realize this is not healthcare coming from a doctor.
Yeah.
So I think,
You're in a really privileged position because you are a doctor, right? So you can put one of these things on and just roughly understand your own physiology. What about our viewers and listeners? Buying a cutaneous or transcutaneous monitor device and then taking the results to their doctor. You need to have a doctor that's ready for that information, right? That's kind of tuned into the wearables space. Not very many of us around.
But that's how I would do it. I would find a healthcare team. I would understand some knowledge. I would go find a doctor or someone to supervise that sort of process and then go ahead and collect that data. I think if you collect the data first and then you're running around trying to figure out who will look at it and help you with it, that's the wrong way to do it.
Yeah. Okay. Amazing.
Great. So that's a good message here. And please put in the chat what you think, what your opinions of wearables are, any loopholes we've missed, any pros we've missed. We'd love to hear from you as well.
Thanks.
Great. See you later.